So I am sitting here with our patient Chris. Chris is a former member of the Canadian bobsleigh team. And Chris, why did you come and see us?
Yeah, my name is Chris. I was on 4 Olympic teams in the sport of bobsleigh. And in the sport of bobsleigh, it requires a great deal of dynamic training, a lot of power training. And in the sport itself, just a lot of dynamic movement. I was a driver, so my head is exposed. And so I had a number of accidents, a lot of whiplash, a lot of scar tissue in my neck. And so I was having some issues. I'm 54 years old now, and I was having some issues, and I was referred to the doctor by one of his patients who's had a great deal of success, and not only has they had success, but they've also seen others have a great deal of success. So I was called to come.
So that's why he came to see us. And Chris, he is working quite often. That's his main occupation. He's working on a computer, and you have got to stay on the computer, and you have had really, because of training in icy regions, and having always a chronic infection here, and have a broken nose, you have had a dry eye. How has that improved when you are staring at your computer? How much? 20%, 60%?
Yeah, so to actually get to the first question on the matter of the sport injuries, I came here with a focus on having attending to my neck, my lower lumbar, and some issues with my eyes. And so the matter of the neck, I actually now am experiencing mobility in my neck to the tune of just the best it's felt in 20 years. Literally.
20 years, unbelievable. For the last 20 years he has had always problems on his neck. Now he feels the best during the last 20 years.
In my lower lumbar, it's an issue that's been expressed more recently in the last, say, 2 to 3 years, and I've experienced the greatest magnitude of improvement over the course of the last 7 weeks that I've been with the doctor than I have in any of the treatments that I've experienced up to this point.
Yes, you have had many treatments by chiropractors, by massage people, and
yes.
And we did a special treatment with you with bioelectrotherapy, and particularly with embryonic human stem cell therapy and an autoimmune vaccine. And what happened to your eyes, your eyesight?
So now, for the last 15 years, I've been in an occupation that it's quite intensive on my eyes. I stare at a computer all day as a foreign exchange trader, and so I was having severe dry eyes. There is a connection. I'd broken my nose twice in sport, but so the doc makes a connection between that and the dry eyes because of the bacteria that builds up in that area. But in the past 7 weeks, since starting the combination of the
human embryonic
stem cells and
the autoimmune vaccine that has been made out of your own blood.
And then the diet, to achieve the alkaline state so that the therapy can be optimized. Not only have the dry eyes improved to the tune of about 70 to 80%, but my reading eyesight, which I've required reading glasses, I'm now experiencing improvement in being able to read without glasses from time to time, but it's improving steadily, and we're still in the pretty early stages of this, but very, very noticeable distinction in not only the dry eyes, but also the improvement in reading.
And the visual acuity. It's not the first time we are seeing the improvement of the visual acuity. I've had a number of other people that nearly couldn't read, even with very strong glasses. Now they finally, after our treatment, they could read with without glasses. Chris, thank you very much.
Thank you.
You are still in the early stages of our treatment. I hope you will stick to the diet and, and the treatment with the injections, human embryonic stem cell injections that will be carried on for the next 4 or 5 weeks.
Thank you.
Okay. And even the hair, I hope we can make the hair grow. I promised him that the hair will be there after about 3 months. He will have his hair regrown again in about three months. Okay. Thank you.
Thank you.